Hi, my name is Tamika, and today I'll be talking to you about a therapist designed adaptive writing in children with cerebral palsy. Does anyone know what cerebral palsy is? No? Okay. Cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. Could anyone imagine not being able to move? I know I couldn't, but this is something that an individual with cerebral palsy faces every day. Cerebral palsy is classified by the main type of movement disorders involved. Depending on the area of the brain affected, one or more of the following movement disorders can occur. You have spasticity, which are stiff muscles, dyskinesia, which is uncontrollable movements, or ataxia, which is poor balance and coordination. For this experiment, the researchers chose to focus on spastic cerebral palsy. Research was conducted to determine whether adaptive riding in children with cerebral palsy improves posture and gross motor function. They wanted to gauge the interaction between the children and the horses and determine whether improvement can be seen in bodily impairments such as spasticity, impaired posture and balance, and if it could decrease limitations in non-equine activities. Because there's a broad definition of hippotherapy, such as therapeutic riding or horseback riding, the American Hippotherapy Association decided to limit the terms hippotherapy, which is any therapy provided by a physical therapist, occupational therapist, or speech therapist that uses movement or the environment of the horse or both to reach specific therapy goals. This also includes adaptive riding, recreational horseback riding for people with disabilities. It can be done one-to-one, as in a physical therapist to a patient, or as in a group. So, this experiment was conducted, included 5 boys and 1 girl between the ages of 6 to 12. They each had to have a diagnosis of spastic cerebral palsy, a gross motor function classification of level 1 or 2, be between the ages of 6 to 12, and the ability to cooperate and follow verbal directions. Trials lasted for 12 weeks with 2 1-hour sessions each week in a group setting. There were a total of 6 horses that were changed weekly, so no child was allowed to ride the same horse each week. A pediatric physical therapist was present at all times. They emphasized self-practice and minimization of hands-on guidance, and they were focused on social skills associated with increased pleasure. So during trial 1 and 2, which were weeks 1 and 2, they measured the spasticity of the muscles by EMG. So what I have up here on the screen are the muscles that were tested, which include the sternocleidomastoid, pectoralis major, rectus abdominis, and deltoid. And then they also tested the biceps brachii and the triceps brachii, just so they can have a baseline at the end of the trial they compare it to. The goal of the researchers was to have the children perform 4 different exercises. The first one was to be able to lift their hands up in the air. Seems like a simple task, but it's hard for them. So they had to be able to do this on a horse, and they always had somebody near them so they would be safe. The second exercise was being able to lean forward and essentially hugging the horse and patting the horse on their neck. Third exercise was being able to give a high five to the walker that was next to them. Last exercise was to be able to lean backward and to touch the horse. This exercise was done while the horse was still though. It was assumed that being able to do these 4 different exercises would improve their posture control and function in daily life. Their postural dysfunction was divided into 2 functional levels. The first one was being unable to control their direction of their spasticity. So they wanted to see whether or not they could change the direction of how their muscles would fire off with the exercises that they were doing. Along with assessing their motor control of their muscles, the pediatric therapist met with and established goals with the parent and a therapeutic riding instructor. There were several assessments that were done to see if the child had improved. The first one was the TDAR intervention, which was designed for each child, and it was a protocol that included exercises in various writing situations and developing writing skills. At the conclusion of the trial, parents were able to answer questions to tell whether or not their child had improved any. The children were tested within 1 week, and the assessment was administered by an experienced pediatric physical therapist. The gross motor function measure was used, and it was measuring their ability to stand, which was their primary measure, and then their ability to walk, run, or jump, which is your secondary measure. Both values were highly acceptable. The next test was the modified Tardieu scale, which measured the spasticity of the hip adductor, hamstring, gastrocnemius, and biceps brachii. And then this test, depending on how fast they were firing off, it will let them know whether or not they had any change or they were still at the same place where they were when they first came in. The results were very good as well. The last test was the pediatric evaluation of disability inventory, which was a Dutch exam, which measures their function in daily life. So they will look to see if they were able to self-care, were able to move, had social function. All of these tests were good as well. In conclusion, overall, testing was a success. Improvement was seen in overall posture control. Their social skills and interactions improved among the children as well. Although this was a very small sample size, they couldn't use these results as a broad range because it only included 5 people. But they could have these results duplicated again based off of what they had. Long-term effects could not be concluded, and the trial was limited to patients with cerebral palsy that only had spasticity, so they didn't use anyone else. Any questions?
I have a question. When they were doing the exercises with the children, you said that this one that you have up there was standing still. The other ones they were moving as they were doing the exercises.
But while they were moving, they always made sure that they had therapists around and then a riding instructor near them, so the horse was never able to like run or gallop or anything like that. They try to keep control of it, but this one was done still. The other ones were done by moving. Any other questions? Thank you.